Hi, my name is Christina. I'm one of the nurses here at the Toronto Dermatology Centre, and I'm going to talk to you a little bit about psoriasis. Psoriasis is a chronic, long-term inflammatory skin disease. That means that it's long-term. Sometimes it can go away, but often you'll have a flare and it will return, and it's caused by an inflammatory process in the body. Psoriasis can occur at any age. Men are equally as affected as women. It is more frequent in Caucasians, but it can occur in any skin type. It is not contagious, so you can't catch it by touching someone, nor can you pass it on to someone else. Approximately 1 million Canadians are affected with psoriasis. That's just under 5% of our nation's population. Psoriasis can affect you anywhere on the body from head to toe, but the most common areas are your elbows, your knees, your scalp, and around your belly button. Psoriatic lesions can be red, anywhere from a light pink all the way to a deep dusky red or almost purple color. The plaques are usually covered in scale, and this can be a fine scale covering just part of the lesion, or it can be a very thick scale covering almost all of the lesion. The plaques tend to be symmetrical. So if you have a plaque on your left arm, you'll likely have a plaque the similar size, shape, and color on your right arm. It tends to mirror itself on one's body. And also these plaques sometimes can be itchy. In order to understand how psoriasis works, you need to know a thing or two about your skin. Our skin consists of two main layers. That's the epidermis and the dermis. The dermis is the middle layer where sort of all your nails, your glands, your hair, your nerves, and your blood vessels all weave throughout. The top layer is our epidermis, which consists of 5 sublayers. The deepest of these layers produce millions and millions of new skin cells each day. And these layers are slowly pushed up towards the surface of the skin where they will eventually, naturally die and flake off. This skin regeneration cycle takes approximately 1 month in healthy skin. Now in the plaques of a person with psoriasis, this regeneration cycle is happening much quicker. It happens in usually under 1 week. This causes a buildup of thick dead skin on the surface that comes off in flakes. And the reason the plaques tend to be so red in color is because the blood vessels are increasing in number and branching up closest to the surface of the skin. That's also why if you try to scratch or pick the scales away, psoriatic plaques can tend to bleed. Plaque psoriasis is the most common type of psoriasis. Approximately 90% of patients with psoriasis have this type. Scalp psoriasis is also very common. 90% of patients with psoriasis have some form of scalp involvement. It's often the very first place that psoriasis will first appear. So at first it can quite often be mistaken for dandruff. Nail psoriasis can occur in 50% of the patients with psoriasis. Usually they have some form of nail involvement. Psoriasis in the nails will cause pitting, denting, a discoloration, a thickening of the nail, and even possible separation of the nail from the actual nail bed. Palmoplantar psoriasis can occur on the palms of our hands or the soles of our feet, and it's usually common in areas that experience a lot of rubbing or friction or trauma. Guttate psoriasis is common in children or teenagers. It usually comes on very suddenly after an infection such as a strep infection, and usually goes away on its own within a few weeks. Guttate psoriasis, once it does go away, may never come back. Other times it can be a precursor to developing plaque psoriasis later on in life. Erythrodermic psoriasis is a severe kind of psoriatic flare that's uncommon, but if it does happen, it can require hospitalization. Unfortunately, at this time, there's no known single cause for psoriasis, but scientists have discovered that 3 main factors play a key role. The first is genetics, the second is your immune system, and the third is your environment. The genetic component just means that it runs in families. The configuration of your immune system plays a key role in that scientists have discovered that in a person with psoriasis, their skin is flooded with a specific type of white blood cell called T cells. These T cells are in our body, and their job is to fight off invaders such as bacteria and viruses. Now in a person with psoriasis, these T cells are not doing their job properly, and incorrect signals are being sent, and these T cells are flooding our skin, causing inflammation, causing our skin to regenerate at a quicker rate, and it's causing the blood vessels to branch up and increase in number. In order to evaluate how severe one's psoriasis is, the medical world has created definitions and rating scales. One of the most popular tools that we use to determine how severe a person's psoriasis may be is something called the body surface area, or BSA. And BSA is simply a calculation of what % of your body is covered in psoriasis. There's two ways to do this. One is the eyeball method, and the second is the palm method, where if you take the size of one palm, this would equal approximately 1% body surface area. So for example, if you had a palm-sized lesion on both your arms and both your legs, we would say that you have approximately 4% body surface area. Mild psoriasis is considered to be usually less than 5% BSA. Sometimes no treatment is required. Sometimes you may be just using topical steroid creams. Moderate psoriasis is anywhere between 5 to 10% body surface area involved. At this point, you may be using topical creams in combination with phototherapy and possibly some form of systemic medication. Severe psoriasis, by definition, is usually where over 10% of your body surface area is involved. You've usually failed topical steroid therapies, and at this point, you need something stronger, such as systemic medication or biologic medication. Unfortunately, just by having psoriasis, it predisposes you to other conditions. So other conditions sometimes tend to travel alongside psoriasis. One of which is something called metabolic syndrome. Metabolic syndrome is a group of symptoms that occur all at the same time and are genetically related to psoriasis. So this would be diabetes, obesity, high blood pressure, and high cholesterol, all of which are bad for the heart and can predispose you to having a heart attack. Other conditions that travel alongside with psoriasis can be Crohn's disease or colitis, again related to the inflammation that's happening in your body. Also, psoriatic arthritis can be common because the inflammation can affect your joints. Also, depression is very commonly seen in patients with psoriasis because patients with psoriasis are usually faced with many challenges in addition to just the physical discomfort. It's not uncommon to have anxiety and depression. A recent study has shown that approximately 58% of patients with psoriasis feel some form of embarrassment or impaired self-image because of their psoriasis. Also, some patients state that they've been rejected in social situations, such as being asked to leave a public space, such as a gym or a pool, because of their skin condition. The study also showed that anywhere between 8 to 10% of patients also might have had suicidal thoughts because of their psoriasis. We recommend that patients go online and seek help from places such as patient support groups for psoriasis, such as the Canadian Skin Patient Alliance. Also, it's very important to stay in touch with your dermatologist on a regular basis, as there are new treatments, new clinical trials, and new understandings that are rapidly taking place. So it's always important to keep in touch to find out what's new and out there to help you.